Hi there, this is Dr. Jim Collins, and I'd like to take a few moments and talk about human trafficking, specifically identifying trafficked people, risk factors for becoming trafficked, and then the kinds of support that we can provide to these folks. Let's start with a good definition, though, of human trafficking. And this I found from an author, Nita Bells, from her book in 2015. Human trafficking is the recruitment, harboring, transporting, obtaining, or maintaining of a person by means of force, fraud, or coercion for purposes of involuntary servitude, debt bondage, slavery, or a commercial sex act in which the person performing the act is under 18 years old. It's estimated that there are over 27 million slaves in the world, more than any other time in history. The largest business in the world involves drugs. The second largest business in the world involves human slavery. The third one involves the sale of guns. How do we identify people? People who are trafficked or victims of human trafficking will most likely encounter an officer of the law or a healthcare professional. These people may be involved in prostitution, domestic labor, agriculture, restaurant work, construction, sweatshops. They might be street beggars. They can also work in the fishing and logging industry, and perhaps they have some type of injury that brings them into the ER. There are risk factors involved. In general, people who are very vulnerable are at greater risk for being trafficked. Women and children are at a higher risk. The poor looking for a better life, runaways, and those people coming from very unstable homes. What can we do to support them? Support is going to be in the forms of mental health, physical health, social, and supportive services. These types of services are out there. I have to admit, I didn't know that they were prior to doing all of this research over the last couple of years, but you have to look for them and find them. There are shelters, there are educational programs, there's food, drug counseling, legal, and job assistance programs. But again, you have to find them. I wrote an article on this and many other topics in human trafficking, so if you're interested, please follow the link for more information. And if you're a licensed healthcare professional, please follow the link below to obtain CEUs in human trafficking. My name is Dr. Jim Collins. Be well and stay well.